If you're looking for a treatment center, you might be tempted to stick close to home. After all, home is everything familiar to you, and addiction recovery is overwhelming enough on its own without adding travel into the mix. But as comfortable as home may be, it's not necessarily the best place for you to find recovery. Let's take a moment to consider your world a little more closely. Home is where unhealthy habits, routines, and triggers formed, and where the people, places, and things that fuel your addiction are always within reach. Home may also be where your addiction went unchecked, and where well-intentioned loved ones enabled your behavior. That's why traveling for treatment can actually be a better option. Think about it. When you travel for treatment, you get the chance to break away from your norm and start fresh in a completely new environment. Imagine how much easier it would be to make real change in your life if you could focus on recovery free from the distractions of home. And don't worry, just because there are miles between you doesn't mean your loved ones can't be involved in your treatment. Being away from home simply gives you the space you need to focus on your own transformation first. Family plays a crucial role in recovery, no matter where you are. But loved ones won't be brought into the recovery process until the time is right, and even then, it's done in a controlled manner. Of course, traveling does make it harder to leave if you decide treatment's not for you, and that can be a scary prospect. But that distance could be the very thing that helps you stay on course when the going gets tough in treatment. Recovery takes time and transition, and there will be days you just want to throw the towel in, especially in the beginning. Being far from home can encourage you to finish what you started by writing out those periods of doubt. Still not convinced? Consider this. According to a recent analysis of data collected from Foundations Recovery Network's residential facilities, patients who attended treatment outside of their home state were 60% less likely to leave treatment against clinical advice. In other words, if it's harder to go home, you're more likely to stick it out, and seeing treatment through to the end is your best chance for long-term recovery. Look, it's normal to fear change. Choosing recovery takes courage, and a journey like this might be one of the hardest things you ever do. But it's also one of the most rewarding, and you don't have to do it alone. Taking the first step is the hardest part, but we'll be with you for the entire way. Give us a call. Your journey awaits.